Hello everyone. Today our group 31 we are presenting our presentation about equal healthcare for all, and as you can see we are all here, and yes, so team 31. What we'll be talking about? We'll be talking about first introductions and main issues, statistics, also some solution methods and conclusion. Now I'll start with introduction. First of all, health quality is an evolving focus which is aimed at ensuring fair access to healthcare regardless of status and with different methods. Now, it's essential for building a fairer society, and because today's system mostly focuses on treating problems rather than preventing them, and to improve this, we need to create a new system. And if we do this, it will reduce inequalities, boost economic productivity, and benefit everyone, and ensure fairness. Now we'll talk about main issues, and now Ibish will talk about main issues.
My name is Vish, and I'm going to talk about the main issues. We actually wrote shortly in our slide what are the main issues. I will talk expanded about them. First, I want to talk about economic barriers. Economic barriers, of course, are money problems. It creates problem for people with low income to get healthcare, and the high cost of medical visits, medicine, and related expenses often stops them from getting help when needed, and this can lead to the late diagnosis and worse health. The next problem is geographical disparities. People living in rural or remote places often don't have enough hospitals or doctors nearby. This means they need to travel long distance to get care, and it can causing the delays in treatment and poorer health. The next one is insurance coverage. It's actually a bit similar with economic barriers. Without insurance, people may face big medical bills, and which discourage them from going for checkups or getting preventative care. This can also lead to bigger health issues later on. The one of them is also cultural and language barriers. It's mainly related to the immigrant. They may struggle due to the language differences or cultural misunderstandings. These issues can make it hard to communicate with doctors, and it can affect the quality of doctors' cares. The next one is racial and ethnic disparities. Bias and discrimination can lead to the unequal treatment based on a person's race or ethnicity, which result in differences in diagnosis, treatment, and overall health outcomes. The last problem is socio-political factors. Government policies and laws play a big role in healthcare access, and cuts to public health programs or laws that limit healthcare can make it harder for certain communities to get the care they need, and widening the gap in the healthcare quality too. Uh, Now I want to pass the word to Nuray Aleva.
My name is Ivan Rai, and following the overview of the main issues, I would like to share some data with you that highlights how serious the problem is. And even today, half of the world's population lacks access to essential healthcare. And another main problem is the huge gap in healthcare spending. The richest 10% of people receive more than half of all global health spending, while the poorest 40% get less than 10%. And as next one, every year 800 million people spend more than 10% of their income. People pushed into poverty. And situation worse, as women are 1.3 times more likely to face unmet healthcare needs, and 25% of Black patients report experiencing discrimination in healthcare settings. Also, there are some geographical barriers. 50% of rural populations in sub-Saharan Africa live over 5 kilometers from clinics. Additionally, one of the barriers is a global need for 10 million healthcare workers. Studies show that 44% of countries have fewer than one doctor per 1,000 people. This inequalities not only lead to suffering, but also lead to poverty and social divide. For a better future, we must address these barriers and create an equal healthcare system where everyone has access to the care they need. Now Aydan will talk about possible solutions.
I'm Aydan Gurbanova, and I will talk about possible solutions to achieve equal healthcare. So as we look at solutions, we can see that there is no single approach. Instead, we're going to need a combination of policy changes, public health initiatives, and international cooperation. First, let's consider policy changes. So the government plays a key role here because by expanding healthcare programs, they can help more people access necessary services. Also, subsidies for low-income families can make healthcare more affordable, and by implementing reforms inspired by successful universal healthcare models such of UK's or Canada's, countries can reduce the financial barriers that prevent people from seeking medical help. In Brazil, for instance, the government introduced a Bolsa Família program that actually led to a 58% reduction in child mortality rates in some areas. So next, public health initiatives. They are vital to address preventable health issues because health education and vaccination and screening programs, they help catch diseases early or prevent them entirely. Finally, we need international aid and cooperation. Organizations like UNICEF, they already work across borders to support healthcare in low-income countries. And by working together globally, we can provide training, share resources, and create more equitable healthcare landscape. So now Rasim will present conclusion.
To sum up, I will say that there are economic, social, cultural, language, racial, ethnic, geographical, and insurance-related barriers to equal access to healthcare. Recommended potential improvements include healthcare system strategies aimed at spreading government programs, increasing health services utilization, such as educational and vaccination campaigns, and global collaboration through international health partnerships. To promote equal healthcare access, it's essential to deal with these disparities, promote health, and do this justly.
So thank you for your attention, and these are the resources that we used. So thank you again.